Welcome to CarePod, a safe place to educate, inspire, and renew the caregiver. Listen in with our host, Dr. Kipley Bell, as she interviews different experts along the caregiving journey.
Okay, so today I'm Mr. Kevin Henze of SimpleC. As we've been discussing on the CarePod, different ways of integrating caregivers and clinicians, families, so that we can best optimize the care we give amongst multi-generational teams and families of caregivers. So welcome so much, Mr. Henze, for joining me today on the CarePod. I appreciate it.
Thank you, Dr. Bell. Appreciate you having me on. Excited to talk with you and share more about SimpleC.
Yes, absolutely. So I always, speak to my thought leaders about their why. What either A, brought you into this space of caring for the older adult person, and B, tell me about how SimpleC came to be.
Oh, for sure. Yeah, absolutely. So I think everybody has been touched by somebody in their life who is an older adult dealing with either a complex chronic condition, could be dementia or Alzheimer's or a variety of other conditions, and they're very prevalent. And that's really my why. My grandmother passed away from Alzheimer's, had a difficult experience near the end of her life. And most people on our team have been touched directly. One of our co-founders cared for both of his parents in senior living, and just oftentimes we find it's not the ideal experience. A lot of our older adults want to have the opportunity to age at home where they're most comfortable. When you're in a hospital, you're in a foreign environment, you're just, lots of sounds and sights, and it's overwhelming. And, being at home is really a great option for a lot of our older adults. So, the reason SimpleC exists, just to outline the situation, the U.S. is experiencing explosive growth in its senior population. Today there's about 57 million adults aged 65 and plus or older living in the U.S. But by 2060, there's going to be nearly 95 million, which is 66% growth. So huge growth in our senior population. Complex chronic conditions are very abundant among seniors and costly for our healthcare system. The stats show that nearly 95% of older adults have at least one complex chronic condition, and nearly 80% have two or more. So a lot of complex needs with that population. Individuals with multiple chronic diseases account for 2/3 of all healthcare costs and 93% of Medicare spending. But we spend as a nation less than 3% of our US healthcare dollar on prevention to improve overall health. So there's a huge imbalance between prevention investment and then end results that we see in our healthcare system. And as you know, from being a physician, chronic diseases can really limit a person's ability to perform the daily activities. It causes them to lose their independence, results in the need for institutional care, in-home caregivers, or other long-term service and support. So those are two issues. Another is the access and affordability crisis in senior living and long-term care. I think a lot of people don't realize Medicare doesn't pay for long-term care. They'll pay for limited stays in a rehab facility. So if you have a hip replacement and you need inpatient physical therapy for a few weeks. But if you really need long-term help with the activities of daily living in a nursing home or assisted living center, you have to pay that yourself. And nursing homes average about $90,000 a year for a semi-private room and over $100,000 for a private room. So it's very cost prohibitive. Also most senior living facilities, communities are going higher end. So they're going for the higher amenity, higher cost model. And more seniors have limited savings to draw upon because of inflation, the dissolution of pension plans, Social Security funding is at risk. There's a lot of other factors. And then access as well. You're reading in the news, nursing homes are closing left and right. There's staffing crises, reimbursement challenges. And a lot of the ones that are still there are changing from double occupancy to single occupancy rooms. So access as well as affordability is really a big crisis right now. And then caregivers as well. Family caregivers. I think this area is close to your heart. But really, a lot of these caregivers have to reduce their work hours and income, or even leave their jobs to take care of loved ones at home. Or they have to work at home when they're overwhelmed with caring for a loved one. So they're being asked to do a lot, and they have limited support and resources at their disposal. One specific condition, Alzheimer's disease and related dementia, the cost is estimated to our nation at $350 billion. That's just for the caregiver informal time and support that's not really categorized. And then when you expect the number of Alzheimer's dementia patients to double by 2060, we're talking about a $700 billion price tag. And this is just for caregiving for Alzheimer's and dementia. So that's really, why we exist. Something has to give. We need low cost, high value technology that supports older adults to live at home safely for longer, assist in the treatment of complex chronic conditions, supports caregivers and clinical care teams with care coordination and management. That's exactly where we come in.
So tell me, I'm stuck on prevention, right? So, all the statistics, kind of ferreting this all out, what do you feel is the best approach? Because I guess I hold prevention and preparation synonymously, right? So how do we best prepare ourselves for this current climate? How did we get here, to this level of kind of disarray, and how do we bring order? This is kind of where I segue into this SimpleC concept, if you will. So what's SimpleC's answer to how we best prevent and prepare for the sequela of chronic disease, et cetera?
Yeah, certainly. So that's the billion or $1 trillion question, right? Is how do we prevent chronic disease? There's so many factors I think we know of, and yet we're not doing really a lot to address. I mean, everything from the ingredients in our food to the environments we live in. There's just so many factors that feed into chronic disease, much more so than just genetics. I personally have multiple chronic diseases myself as a younger man. So I know they can just sort of sneak up on you either unexpectedly or they can be lifestyle driven. So, I think the answers are big and complex. We really need, a lot more probably government intervention and direction, as well as in partnership with commercial, vendors who can support with issues like these. SimpleC, we do help with prevention, but we really are geared towards older adults, so those 50 plus or 65 plus, and so we support across the entire aging care continuum, from those who may already have chronic conditions or those who don't, are entirely active and independent but need additional support living at home. So we really support across that care continuum. So basically, we were built for innovative providers and families living with complex diagnoses, including dementia. We've done extensive research in these areas. We've done 38 clinical outcome studies with our technology to date, largely funded by NIH grant funding. We've got 9 US issued patents, so we've done a lot of innovation in this area.
How cool is that?
Yeah, it's very cool. We've been big on IP, and our team has done some great work with getting those, first the inventions created, but then the going through the work of getting those patented is a heavy lift.
Absolutely. So just for the layman audience, what exactly is SimpleC? Like, what is SimpleC, and what do we hope to achieve for families?
Yeah, absolutely. So, we early on, we earned our chops working with the most advanced cases of dementia and Alzheimer's in long-term care communities. But like I said, we've really expanded to effectively serve older adults across the continuum. We've built a completely digital and cloud-based set of applications that empower what we call care recipients. These are older adults using our platform together with their families and caregivers and clinical care teams. We give them the tools, support, and insights to better manage their care, increase their engagement and social connection, boost their health and wellness. And we provide those valuable data-driven insights into the home environment. So wherever that care recipient calls home, it could be in their personal home, it could be in a senior living facility. Our applications are device agnostic, so they can be deployed on any smartphone, any tablet, or any desktop or laptop computer. Some of our apps can also be used on a television, so that's very helpful in the home environment.
Oh, wow. Okay.
And they can be placed on a counter, on a desk, can be mounted on a cart that you can roll around easily. It can be on a wall arm, or any variety of other options to make these easily usable as a daily assist living device. We're actually FDA, we're registered with the FDA as a Class 1 daily assist living device. So we've got that partnership with the FDA. And
so
so
take
what
us,
our companion
take us through it.
Yeah.
Take us through it.
Certainly. So we've got a large number of applications that are useful in a variety of areas, but I'll take you through our companion app, which is our primary one. It's care recipient facing. And basically companion is always there with the end user, with the individual. It's designed for seniors. It's easy to see. It's easy to engage with. Some of the key features of companion are, first of all, daily schedules with automated cues and reminders that drive, successful adherence and completion of ADLs, IADLs. It's basically, activities of daily living. We built in digital therapeutic tools. So we've done a lot of work in this area with music therapy, reminiscence therapy, validation, reality orientation, simulated presence. That's where a family member can, join in. They can leave voice messages for the end user, encouragement. They can say, hey, granddad, don't forget to take your medication today, things like that. So really, it's about keeping them on track, keeping them, calm, oriented, taking care of those things they need to do to be healthy and happy throughout the day. Highly personalized. So we capture and we integrate all the users, history, background, everything to their favorite music. We incorporate personal pictures and videos. There's a secure set of personal connections in the tool. And really, we build in their current care goals and personalize their experience to help them achieve the best possible outcomes and stay on track with their care plan. So that's kind of the biggest value. Other features, we have one-touch video and voice calling and messaging with loved ones. We've got cognitive games to help keep the brain sharp. We're building in a really advanced avatar for companionship, communication, and coaching. And then the last thing I would say is we also have a complementary set of family-facing and clinician-facing apps that really build out that 360-degree circle of care, awareness, and insight. So the family's getting engaged if they choose to. The care team is getting engaged. They can share notes, share assessments. They can see real-time the status of the individual based on data that's collected through the app or surveys or notes left by the family or care team. So really, really powerful stuff.
Yeah. So what does that look like in real time? So, is this both an option for the clinician at bedside, like systems or institutions to use SimpleC, where they are, integrating the care plan with the outpatient family and the patient at bedside to kind of integrate the options that are clinically appropriate and socially appropriate, or this looks like an app for families to opt in. So tell me specifically what that looks like.
Yeah, all of the above, actually. So some of the partners we work with, they could be providers like physician groups, they could be home health agencies. We're working with innovative adult day centers. So really, like you said, we want to capture up front the really actionable information about the care plan and then build that in a very personalized way to make sure that we're getting the best possible outcomes. So that could be things like, what are their favorite interests, things that keep them calm and happy throughout the day? What are their care goals? How do we build that into their daily schedule with cues and reminders? Automatic, these come up automatically. They're typically multimedia based. So they're entertaining. They have visuals, they have the user's favorite music. And then if, we keep the communication circle tight as well. So we build in their trusted users, could be, family members, could be clinical care teams, so they can get in touch anytime. They can, keep that social connection up. And we've done a variety of things, with engagement and social connection with peers as well. So for instance, at some of our deployments in senior living facilities, we'll have things like Know Your Neighbor, where you can see pictures of your neighbors and you try to, match the name to the picture. You learn about their interests and history and really build relationships that way. So there's a lot of different things we can do with these tools.
Nice.
In the fast-paced world we live in, being a caregiver is more demanding than ever. But what if there was a solution that could ease your burden? Introducing CareCab. CareCab is not just another ride-sharing service. Our drivers are vetted, trained, and certified in the care of the older adult person. They understand the intricacies of geriatric emergencies, recognize medical devices, and are equipped with the patience and demeanor needed for older adult persons. Our drivers undergo rigorous background checks and are trained in first aid and CPR, ensuring your loved ones are in safe hands. From everyday errands to critical medical appointments, CareCab is here to lift your day-to-day caregiver burden. Let CareCab be your ally in caregiving. Contact us today and experience the difference. CareCab, because caring starts with us.
Nice. So what is your favorite option on the platform?
I would say I kind of like it all. I actually like playing some of the games when I'm not not busy in the office. But yeah, there's a lot there. I think the most valuable we found is that one-touch communication feature. So the easy, you just touch who you want to call, you get the live video feed immediately. Works very well, and that really just helps build the connection with family. Allows families to keep in touch. And I'd say that's probably my favorite feature, but the avatar is really cool as well. We're working on making that a really interactive, friend and companion to the end user, somebody they can ask questions to and really can, prevent loneliness, things like that. So,
yeah. So tell me about access. How does a family or system gain access to SimpleC? What does this look like in real time to be able to get it to the consumer?
Yeah, certainly. So historically, we've mostly had a business-to-business model. So we're working with large, customers who see the value and want to really help provide better population health management for their either their membership or their patients. And so we don't at this time have a direct-to-consumer model, but that is something that I think in the future we do want to explore that, because it's very, as you pointed out, it's very simple and easy to deploy. All you need is to download the app on your smartphone or on your tablet. We can even help connect you with the hardware, the tablets that you need to get this up and running. But we have a smooth onboarding process, just makes it quick and easy. Gets the families connected in, gets the clinical care team connected. So it's, I think there's definitely opportunities in the direct-to-consumer arena.
Okay, so clinician opts in and says, hey, I'd like to offer SimpleC to my families. That would be first step. And then, go ahead, take us through it.
Yeah, absolutely. So we've partnered with like I said, a variety of organizations. Historically, we worked with senior living communities, from long-term care, nursing homes, independent living, assisted living. But we have since been partnering with, a variety of home health agencies, adult daycare centers. We're working with some ACOs and physician groups who are working with guide participants. So, it's really expanded. I think the core value is it's so flexible. You can deploy it in any environment or workflow. It's easy to scale, easy to, train users on. And so that's kind of a blessing and a curse. Like we have a lot of interest, but, staying focused is a challenge because we're talking to a variety of customers, and that, it's good and it's bad, but we love that there's a lot of interest and that's usable in a lot of environments, and our work is sort of paying off and benefiting end users.
Nice, because it allows, I guess, you to bridge the gap between the institution or the entity and the family while offering that personal touch as well. Do you have any visuals for our YouTube audience to demo it?
I can find a single image here of what the products look like, and I can pull that up.
Okay.
Well, this is a visual representation of some of our applications. The one I've been talking the most about is the SimpleC Companion at the bottom. This is the one that is end user facing. This one looks a little bit plain, but we can basically white label it. Put any organization that chooses to use this. It's really their product, so we put their logo on there. But you can see the ribbon orientation, kind of a Netflixy style, where we have the different categories like today's schedule, my music, my photos and videos, things like that. And then the Family Connect and Clinical Connect are the tools that link in the full care circle. So the family member can adjust therapies through the app. They can upload media. They can complete notes and assessments that the care team can see, and basically provides that trending data. And then the clinical team here, of course, you can see there's some data shown. There's an easy visual representation of how they're doing on, did they have a good day? Are they drinking their water? Are they taking their medication? And then when you see those data points that are off target, you can quickly react. And we also have the ability to build in alerts, so we can alert the care team if something is out of range, and that, enables immediate response and just reduction of negative health outcomes. And then we've got a few of our other products shown here. Community Connect is something that we use. We've deployed in a number of senior living facilities. This is an activity and engagement support application. So basically helps in group settings, really getting engagement, building cognitive connections, building social connections. And then Companion Q is a digital signage feature that we're doing more and more with. Basically provides targeted information when a care team goes in a resident's room to see, what is their status? Do they need special PPE requirements? They can click into a menu and see their bio before they go in the room and say, okay, I know these things about Elizabeth. I can have a better conversation with her when I go in. So a lot of value in that tool as well.
Okay, great. And so what if a family has an issue and they say, hey, we want to alert the care team? Does this allow for that?
Yes, absolutely. Yeah. So they have a number of options. They can either do a voice call, a video call, a text message, whatever they're most comfortable with and the care team's most comfortable with. And then the end user as well, so that they're not always reaching out and kind of, maybe taking time away from the care team. Theirs is more of a request. So it says, hey, I need help with X, and they pick the category, and then that goes to the clinical care team member, and they can respond back at their earliest convenience. So we've got all those features built in.
Great, great. So where do you see the future of SimpleC? Tell us about the avatar. I'm curious about the offerings there.
Oh, yeah. There's so much opportunity there. I think you're starting to see in the market, everything from robots that, move and do chores around the house to more of a screen-based avatar that's more of just a friend and companion. So there's a lot of ways you can go with that. And we want to make sure that we provide, a really great option to, already we're basically supporting the caregiver. We're providing, semi-respite type care. We're reducing the negative health outcomes by keeping patients on track with their medications and daily activities, but the avatar can go even further in being a, sort of a friend and companion, or even a coach, providing, safe health information to, really keep the care recipient on track. So we're excited to see where that goes. And we already have a fully operating model with that, but we're continuing to iterate on it and just take it to the next level.
Love it, love it, love it. So, okay, the billables, the big question becomes, okay, the client of SimpleC, like myself or an entity, would opt into your product and then provide the service to the family. And does the insurance cover any of these offerings?
Yeah, so we've historically worked with our partners on creative pricing arrangements. They could be either the organization sponsors the cost directly. We do some cost sharing between the sponsor and the family member. So we have a variety of options there. As far as payer coverage, we are researching basically the Medicaid waivers in a number of states where users can self-direct a pool of discretionary funds to pay for this service. So that is one avenue we're looking into. We're also directly talking with some major commercial payers about covering this as a covered benefit for their members. So doing a lot of work there.
That's amazing. That's amazing. That would be a game changer, really.
Yeah. And then one thing we've heard about more recently is remote therapeutic monitoring codes. A lot of, for instance, physical therapists and others are using those to bill for services delivered at virtual technology like this. So we're doing some research to see perhaps if RTM codes would be applicable for, general providers like primary care and family medicine. So we're doing some more work on that as well.
Love it. Love it. Love it. So fill in the blank. SimpleC is.
Yeah, that's a great question. SimpleC is really the best. I'd say it's the best option for older adults to age at home safely, who want to be at home and don't want to be in either senior living or in the hospital, and really provides a lot of support and tools that you need to be successful, healthy, happy, and connected.
Love it, love it, love it. Well, I really appreciate you sharing this platform. I think it's an opportunity on both a systemic level and on, a small scale like myself, a personal level for a roster of patients that can be served in this way. especially in the tech savvy world that we are in, and also addressing the access to care in terms of the Medicaid client and trying to make inroads to provide access to that population as well. So I think it definitely has a place in the market. So I definitely wish you both success in this regard.
Thank you, Dr. Bell. I really appreciate the opportunity to come on and talk with you and share more about SimpleC, and happy to answer any questions. If anybody wants to learn more, just reach out to me directly or visit our website at simplec.com.
Yeah, so simplec.com. And again, if they wanted to reach you directly on a corporate or smaller practice, private practice scale, they can get to you through the website as well?
Yeah, the best way to reach me is my email address. It's khenze@simplec.com.
Okay, simplec.com. You hear it. You heard it on CarePod. Thank you so much.
Thank you, Dr.
Thanks
Bell.
for joining us. Thank you.
Great information right from the source. For more information on how to caregive like a boss, check out impactfulcaregiving.com. Want to be a guest on the show? Contact us at CarePod at impactfulcaregiving.com.